Bienvenidos y muchas gracias. Me dicen que la sala está llena. Les comento que estamos transmitiendo de manera simultánea en la página de Facebook de Amigos Universidad Bar-Ilan, México. Por favor, si saben de alguien que no está logrando entrar, pueda pasarle este mensaje y que pueda acompañarnos. Los saluda Nelly Cohen, directora de Amigos de la Universidad Bar-Ilan en México. Nos acompaña el ingeniero Nathan Feldman, presidente de nuestra organización, y Nati Glikin, de la Oficina Internacional de la Universidad. Para la Universidad Bar-Ilan, más allá de la excelencia académica, es muy importante el impacto global. Y a eso nos dedicamos día con día, impactando el futuro hoy. Además del firme compromiso de fortalecer la identidad judía, para que el Estado de Israel siga llenándonos de orgullo como el Estado judío. Quiero invitarlos a que hagan sus preguntas en el chat en cualquier momento. Y al finalizar la conferencia, daremos espacio a las respuestas. Síganos en redes sociales como Amigos de la Universidad Bar-Ilan, en Facebook, Instagram, YouTube y en la página web, donde además podrán enterarse de nuestros siguientes eventos y podrán ver la grabación de esta y otras magníficas conferencias que hemos tenido. Hoy nos acompañan dos grandes personalidades y nos sentimos muy honrados de tenerlos esta tarde. Ellos son el doctor Kably y el profesor Edelstein. Les agradezco profundamente su participación. El doctor Alberto Kably es fundador de la especialidad de Biología de la Reproducción en México, pionero y líder en el campo de la reproducción asistida. Ha sido presidente de varias instituciones médicas y académicas en nuestro país, miembro emérito de la Academia Mexicana de Cirugía de 1997 a la fecha, del American College of Obstetrics and Gynecology, European Society of Human Reproduction and Embryology. Premiado en 7 ocasiones con el primer lugar de investigación clínica y o básica en los congresos mexicanos de ginecología y obstetricia. Ha publicado más de 250 trabajos de investigación dentro del campo de la ginecología y biología de la reproducción en revistas nacionales y extranjeras. Actualmente es director de la Unidad de Reproducción Asistida del Centro Especializado para la Atención de la Mujer del Hospital Ángeles de las Lomas. Y además, en los últimos meses, ha sido pieza clave para el manejo de la pandemia y toma de decisiones del COVID-19 para la comunidad judía. Muy querido y respetado doctor Alberto Kably, le pido por favor que nos dé una introducción sobre la situación actual del COVID-19 y la vacuna en nuestro país, y posteriormente presente al profesor Edelstein para que comience su presentación.
Gracias, Nelly. Gracias, Nati. Antes de iniciar una presentación que será muy breve, porque no quiero quitarle minutos al profesor, quiero en primer lugar agradecer a la Universidad de Bar-Ilan, particularmente a Nelly y a Nati, el haberme considerado para coordinar esta conferencia. Obviamente, dada la importancia de la universidad en la enseñanza y distribución de salud en el Estado de Israel y su magnificación hacia afuera del Estado de Israel, hacia todo el mundo, en cuanto a conocimiento se refiere, básicamente en este caso, en el estado de la vacuna de COVID. Entonces, muchas gracias. En segundo lugar, muchos de los presentes se preguntarán qué hace un ginecólogo o biólogo de la reproducción coordinando una sesión de vacunas en alguna enfermedad infecciosa, y como ya decía Nelly, se me ha asignado algún cargo, y por otro lado, pues como médico he estado participando dentro de mi hospital y dentro de nuestra clínica en la atención de pacientes, mujeres embarazadas, no embarazadas, que tienen COVID, en arreglar un poco una área que tenemos en el Hospital Ángeles para atender ya un buen número de partos de mujeres que tienen COVID, y obviamente, como mencionaba Nelly, involucrado en la toma de decisiones en algunos grupos sociales en México. Dicho lo anterior, no voy a profundizar mucho en la situación del país. Ustedes saben que en el momento actual, incluso considerando exclusivamente las cifras oficiales que probablemente disten mucho de la realidad, pero en eso no me voy a meter, las cifras oficiales son suficientemente explicativas de la cuantía de la epidemia que tenemos en México, con más de 1.600.000 contagiados y más de 140,000 muertos. Esto es suficiente para estar preocupados. No encontramos una solución fácil. Muchas partes involucradas en el problema, tanto públicas como privadas, se han dado cuenta que posiblemente no se haya manejado en forma adecuada, que posiblemente las características del insumo de vacunas y la distribución de las mismas no vayan a llenar con las expectativas, por cierto, muy modestas de nuestro gobierno para cubrir a toda la población. De tal suerte que es un problema que tenemos en la cabeza. Yo esperaría que las conductas se rectifiquen, que este año se acabe de vacunar a toda la gente, o cuando menos a la gente más propensa a sufrir la enfermedad con consecuencias serias en el país. Y la única forma de lograrlo, bueno, pues por el momento actual que no contamos con medicamentos, aunque hay investigaciones al respecto, son las vacunas. Y dentro de las vacunas, que ustedes saben hay muchas y que hay muchos expertos, tenemos ahora a uno de los expertos internacionales en la cuestión de vacunación contra COVID-19, y este es el profesor Edelstein. Dr. Edelstein, I'm going to speak in English just to make the presentation of yourself, and after that I will give you the microphone. It's an honor, as you know, and a pleasure meeting you again, Dr. Edelstein, today in a very important conference containing information for those people interested on all we have to know about the COVID vaccine. I'm starting introducing you to the public with your CV. We'll do it in Spanish, as I know you can understand. I'm going to introduce you, el profesor Michael Edelstein. Voy a leer su currículum. El profesor Edelstein es médico de salud pública formado en el Reino Unido y especializado en enfermedades infecciosas y epidemiología de vacunas. Se unió a la Facultad de Medicina de la Universidad Bar-Ilan como profesor asociado en agosto del 2020. Sus principales intereses de investigación se centran en la entrega equitativa de programas de salud pública, aprovechando herramientas digitales para mejorar la salud pública y el impacto a largo plazo de la pandemia de COVID-19. Antes de unirse a la Universidad de Bar-Ilan, el profesor Edelstein fue uno de los epidemiólogos médicos seniors responsables del Programa Nacional de Inmunización de Inglaterra en PHE, la Agencia Nacional de Salud Pública de Inglaterra. También fue miembro del equipo de vigilancia nacional de COVID-19 en Inglaterra. Como profesor asociado honorario de salud pública en la Escuela de Higiene y Medicina Tropical en Londres, su investigación se centró en las barreras y los facilitadores para reducir las desigualdades en salud en los programas de vacunas. El profesor Edelstein también es editor adjunto de la revista Epidemiology and Infection, presidente de la sección de enfermedades infecciosas de la Asociación Europea de Salud Pública y miembro de la Facultad de Salud Pública del Reino Unido. Ha formado parte de grupos de expertos para la Organización Mundial de la Salud y el Centro Europeo para la Prevención y Control de Enfermedades. Tiene más de 50 publicaciones al respecto y la dinámica va a ser que el profesor va a exponer su conferencia. Ustedes pueden ir enviándonos sus preguntas que yo iré centralizando para al final de la conferencia tener un espacio para realizarlas. I know that you understood me, Dr. Edelstein. Anyway, the microphone is all yours. And for everybody's information, as I told, we will have time after Dr. speech to make some questions. Dr. Edelstein, please.
Thank you very much. Muchas gracias. Es un placer estar acá con vosotros. Y lo siento que no puedo presentar en español. Mi español no está fuerte as I will switch to English, but you can ask me questions in Spanish, I will understand. Let me share my screen. Up. Okay. Can you see the slides?
Yes, we do. Yes.
Okay, excellent. Okay, so let me begin because we don't have a lot of time. I'm going to try and give a short presentation because I already see in the chat that there are a lot of questions, which I think will be the highlight. I've called the session Everything You Want to Know About COVID-19 Vaccines, but are afraid to ask. So this is really your opportunity. There are no, every question is valid and every question I will try my best to answer. I just want to begin by reminding everyone, Dr. Kably gave an overview of the situation in Mexico, but worldwide the situation is really, really tragic. And as of a few days ago, there were 91 million cases in the world and close to 2 million deaths. It's a really tragic time that we're living through. And many different countries have tried many different approaches to try and control this outbreak. Lockdowns, social distancing, masks. And here what I've done is I've shown a few examples, just including Israel and including Mexico, to show that regardless of what approach countries have taken and regardless of how well implemented they were, no country, except for maybe one or two, have managed to control this pandemic. So there really needs to be a new tool to offer hope. And I think this tool is vaccines. And vaccines are really going to be the only way out of this pandemic. Luckily, in the last month, there has been several candidates, several vaccines from different manufacturers that have shown very high efficacy from the US, from Russia, from the United Kingdom, and all of them seem to show very good efficacy, very promising results, which is incredibly encouraging. And there are many, many more. If you look around, there are more than 150 COVID-19 vaccine candidates that are in development from many, many different countries, including 63, which are in advanced stages of testing that have entered clinical trials in humans, which are advanced enough to be tried on people. The others are still being tested on animals. And I'm just mentioning a few here, and I've chosen, I'll explain in a minute why I've chosen these. The first three, Moderna, Pfizer, and AstraZeneca, are three vaccines that are now licensed and are being used, including in Israel and including in Mexico. I think in Mexico, you have a few doses of the Pfizer vaccines, and I've included the last three vaccines, Novavax, the Janssen vaccine, and the Chinese CanSino vaccine, because even though these are not yet commercialized and licensed, they're actually being trialed in Mexico. So I thought it was Mexico is one of the testing sites for these vaccines. So it may be that these are vaccines that are available in your country. And these rely on different approaches, different technologies, and I'll try and explain those in simple ways. The first three all show very good efficacy. They work very well against disease. They all need 2 doses. There are vaccines that are coming in the future that will only need 1 dose, and we'll explain why this is important. So you may have heard, for those of you who have followed a little bit, you may have heard that the vaccine that exists use different technologies. Some use what's called, they are called RNA vaccines, and some are using a viral vector. Now, I just want to explain this a little bit because I know that particularly the RNA vaccine, which are the Pfizer vaccine and the Moderna vaccine, have caused some concern. And these work in the following way, to make it simple. The vaccine includes a tiny, tiny little bit of RNA. And the RNA is a piece of genetic sequence that contains the code to build an antibody against the virus. Now, this code is made in a lab. It's synthetic RNA. It doesn't come from the virus. And then what it does when it enters the body, it gives an instruction to the cells of your own body to create the antibodies, which are the feature that allows you to fight the virus. And this is a new technology, and although the technology has been developed for a long time, it's the first time that it's used in a real vaccine, and therefore it's very encouraging to see that both the Moderna and the Pfizer vaccine that use the technology are showing very, very good results. Now, there have been concerns, or there has been some people raising the possibility that because you use RNA, you use a genetic sequence and you inject it in the body, it can cause modification to your own DNA. That is not possible. So there is no real risk of modification of your own DNA using these vaccines. And we'll talk about vaccine safety a little bit more later, but I just wanted to make this point now that from the biological perspective, it is not possible to modify your own DNA using these vaccines, but they show very, very good efficacy and they're very safe. The second category is viral vaccines. So they use an existing virus, not a COVID virus, another virus. In the case of the AstraZeneca vaccine, which is the viral vaccine that is currently being commercialized, it's actually a virus from chimpanzees that do not affect humans, that do not cause disease in humans, but they have the machinery to build proteins. And what they do is they again use a little bit of genetic sequence from the virus and include it into this chimpanzee virus to build the proteins that allow to fight the virus. So these are two different approaches that both have shown to be effective. So are these vaccines safe? Because I know a lot of people are worried about this, so it's important to talk about it. One thing that, one of the questions that I get very often is, normally a vaccine takes 5 or 10 years to be developed, and here we develop these vaccines in 1 year. How can we be sure that, the companies have not cut corners, that they haven't compromised on safety in order to release the vaccine quickly? So I think it's important to understand where the time has been gained. And normally what happens in a normal vaccine development, which takes 10 years, sometimes more, is you have a lot of time spent on what's called preclinical studies, which are essentially when you research the vaccine in animals or in a lab. Then you have the clinical trials when you try the vaccine on humans. And then once this is shown to work, it needs to go through an approval process, regulation process. And then then you need to build, once you know that you have a product that works, you need to build a factory and you need to produce the vaccine in a mass scale, which takes a lot of time. What they've done here is not shorten the time that they've tested the vaccine, but the preclinical time was much shorter because they use technologies that have already been existing for 10 to 15 years. So actually, a lot of this work was already done anyway, and that time was saved. But the really unique thing that happened in the production of the COVID vaccines is that instead of waiting until the trials were finished to approve the vaccines and manufacture the vaccine, they actually started this process at the same time. So they gained 5 years just by doing this. And this is how, and this is why the vaccines were able to be released in a way that was much quicker than the normal way of developing vaccines. So the process of regulation, of checking if the vaccine is safe, hasn't really been changed. It's the manufacturing process and the licensing process that mainly have been shortened. This is from the Pfizer, and I've chosen Pfizer because this is the vaccine that is beginning to be available in Mexico, I understand. Safety profile. So what people have mentioned when, in terms of side effects when they receive the vaccine. Like every vaccine, some people feel, a little bit tired for a few days, maybe a headache, a bit of pain at where the vaccine gets injected, but nothing more than that. So nothing more than any other vaccine that people will have received, like, the flu vaccine or childhood vaccines, nothing out of the ordinary. And this was tested, the vaccine, before it was released on population, it was tested in very large trials. There were more than 120,000 trials in the people in the trials for the Pfizer, AstraZeneca, and Moderna vaccine. So for vaccine studies, it's actually quite a big number. But to reassure you further, since then, it's been given to about 30 million people worldwide. And in Israel, among the 650,000 people who received the first dose of the vaccine, which is already 10 times more than those in the trial, about 1 in 1,000 reported discomfort, and 0.01%, 1 in 10,000 people actually went to see the doctor because they felt unwell. So a very low number. How effective are these vaccines? Well, you will have seen that, in the newspapers, on the internet, you will see these figures being quoted: 95% effective against being sick, or 70%, 80%. Now, it's important to understand what this means. This means that in the trial, the risk of being sick, which is not the same as being infected, because you can be infected and not sick. But the risk of being sick decreases by 95% among those who received the vaccine. And before the vaccine was released, we didn't really know whether the vaccine actually stopped people from being infected. But data from Israel, which is the country that has been vaccinating the fastest, and therefore is the first to have the data to show these things, has shown that actually the vaccine doesn't just protect against becoming sick, but it actually protects against being infected as well, which is fantastic news. And we're really proud that Israel is the first country to be able to release this data. Okay, one of the big challenges now that we have several vaccines, and there are many more comings, is who to give the vaccine to, because as Dr. Kably said, there is not going to be enough vaccine for everyone straight away. It will take some time to have enough. And even though the number of doses being produced is rapidly increasing, we're already seeing that not every country has access to the vaccine, and within countries, not everyone in the country will be able to receive it straight away. So it's important to decide who to give the vaccine to first. And there's two elements to that. The first one is which countries, and the second one is within the countries who to give it to. And I think there is a temptation for each country to try and get as many doses as possible for themselves to protect their own population. And of course, this is important, but I just want to remind you how we went from the situation on the left, which is, a few cases of COVID in China, and maybe 1 or 2 in Thailand, to a global pandemic with every single country in the world being affected. This is because we live in a global, interconnected world. People travel, people go on business, people go on holidays, and when a risk of disease appears somewhere, this risk spreads to everyone. Exactly in the same way, the only way to be truly protected against a pandemic is not just to protecting ourselves, but also protecting others. Because otherwise, whenever you travel, whenever people enter your country, there will be a risk. So it's important to have a balance between protecting your own and protecting others. And there is a saying in infectious diseases that our collective protection is only as strong as our weakest link. And within the world, and it's also true within a country, until everyone is protected, no one is protected. Having said that, there are difficult decisions to be made because there are not enough doses, and even within a country, you know, a country like Mexico or Israel will receive a certain number of doses, and then you have to decide who you give these doses to. And there are recommendations here. I'm showing recommendations from the World Health Organization, on the right from the UK. Generally speaking, there are two approaches, two categories of people that are protected first in almost every country. Older people, because they are more vulnerable, they are more likely to have serious COVID-19 infection, and healthcare workers, because if they get infected, they can infect others, and it also, if they're infected, they cannot work, and it makes the situation worse. And this is a good strategy if you want to protect those who are most vulnerable, if you want to protect those vulnerable against serious disease. But there is another strategy, which with time, when more doses become available, needs to be considered, because even those who are older, you know, 75, 85, 80, 85 years of age, are most vulnerable. They are not the one that are giving COVID to others, because these people are mainly, you know, staying at home, protecting themselves. They have less opportunities to infect others than young people. And if we look at how the pandemic has changed over time, what we see is that as time goes, the average age of those who are infected decreases. And what we see now is that actually, even though the older individuals are more vulnerable to COVID, the younger individuals are those who are driving the pandemic and continuing spreading the infection. So you could argue that actually, if you want to stop the pandemic, you have to also vaccinate younger individuals. And it needs to be a balance, and this balance will change between older individuals and younger individuals as more and more doses become available. On one hand, protecting those who are vulnerable. On the other hand, stopping the disease from spreading by vaccinating those who are spreading. And what we know is that the spread of disease is not uniform. There are a small proportion of cases who actually account the majority of other cases. So you have to find these individuals, and these tend to be, again, younger, socially active individuals who meet a lot of people. And if you really want to stop the pandemic, you also have to vaccinate them, not just the most vulnerable people. So yes, vaccinating against COVID-19 is going to be the key to ending the pandemic, but having the vaccine, as we mentioned, is only the beginning of the story, because once you have the vaccine, you have to package it, you have to store it, you have to distribute it around the world and within countries. You have to offer it to people. People have to accept it twice, because there are 2 doses for the current vaccines. Then you have to be able to capture the data to understand who is vaccinated, who is not vaccinated. And each of these steps is complex in its own way. So you can see that just receiving the vaccine in the country is not the end of the story. So I just want to show you how we go from 95% efficacy. And if you imagine that a vaccine with 95% efficacy arrives in Mexico today, they will not imagine that you receive, I think there's 130 million people living in Mexico, more or less. Imagine that there's enough for 90 million or 80 million, which would be amazing, right? In the first year. Well, of these, not everyone is going to accept the vaccine. Some people are anti-vaccination. Some people will forget to go. Some people will just not think it's that important. And of those who accept, 10% will maybe forget to go back to the second dose, or for one reason or another, they will not be able to go. And of course, 1 dose will give you less protection than 2 doses. So actually, even if you have a 95% efficacious vaccine that comes to the country with enough doses to cover 80 or 90 million people, you will end up with 50% of the population who's directly protected. And that is why, even though the vaccine is becoming available, it is still incredibly important until the situation clarifies and until enough people can be protected to continue with social distancing, with wearing masks. These things are not going to go away as soon as the vaccine is available. There will be a period of time that could be a few months, maybe a year, that where both will be needed, where you will have the opportunity to be vaccinated, but you still need to practice these things. I now want to talk a little bit about Israel, because we're very proud in Israel. We've been consistently the country who is vaccinating the fastest in the world. We are way higher than the second best, which is the United Arab Emirates. I think Mexico is just beginning. And what I want to do is just spend a few minutes on trying to understand why Israel has done so well with vaccination. Of course, one of the factors is having the vaccine available, and the Israeli government has done some amazing deals with, particularly with Pfizer. What they've done, and we could have a whole discussion about whether, you know, the ethical dimension of what they've done, but they've shared all the data that they're collecting about the vaccine and vaccination with Pfizer in exchange for receiving enough doses to cover the entire population in the first few months of the vaccine being available. So this is the first factor, having the vaccine available. The second one is, unlike Mexico, we're a pretty small country. I think I counted how many times you can fit Israel in Mexico. It was quite a lot. I think 20 times or something like that. And the population is very concentrated. So it's quite easy to, you know, to reach everyone. You don't really have very remote areas or very rural areas. And this helps when, you know, particularly when a vaccine needs to be stored at -70 degrees. It may be that, you know, for remote rural parts of Mexico, it's quite difficult to keep a vaccine at -70 degrees all the way to the patient. In Israel, we don't really have that challenge, and that makes it much, much easier. Another factor that plays in the favor of Israel is that it's the country that has the experience, for better or for worse, of managing emergencies, you know, conflict. And therefore, it means that when a national crisis like a pandemic arises, there are already agreements, for example, between the army and the healthcare system, so they can help straight away delivering the vaccine. And that has been a huge, you know, a huge benefit for Israel to have this culture and agreements between different services to work in an emergency. The third thing is, or sorry, the fourth thing I should say, is that the healthcare system is quite centralized. We have 4 health maintenance organizations, and everyone by law is obligated to be a member of these. So it's very easy, you know, you reach everyone. You don't really have the issue of private versus public. Everyone is a member of the system. And that makes it easier to deliver the vaccine, to identify people who are eligible, regardless of, you know, whether they're rich, whether they're poor, where they live, whether they're Jewish, whether they're Muslim. It makes no difference. And these healthcare maintenance organizations, they have very, very good data. Israel is really a pioneer in healthcare data and electronic medical records. And this is important because it means that everyone can be identified. Everyone who's eligible can receive you know, an SMS, a text message saying, you're now eligible for the vaccine. Please make an appointment. You make the appointment in the app and you are called. And if you forget to come, they will send you a reminder. So, you know, the ability to identify and recall people is excellent. Another point is that the system is quite flexible. And, I was hearing from my colleagues in England that they have such strict guidelines that they actually throwing doses of vaccine in the bin because, at the end of a day, for example, they will have doses left and there's no one left in the right age group to vaccinate them. So instead of giving them to younger people, they will throw them in the bin because the younger people are not eligible according to the guidelines. Whereas in Israel, I think there's a little bit more common sense and a little bit more flexibility. So it's not uncommon for a health clinic to send a message to its patients at the end of the day to say, there are doses still available, please come in the evening to receive them. And in that way, there's very, very little wastage. There's almost no doses thrown away, which, in the current situation where many people can't access the vaccine, throwing doses away is crazy. Another factor is that the government has made a great effort to suppress anti-vaccination websites. I'm sure you will all have heard of anti-vaccination, and your neighbors to the north it's a very, very big issue there. I don't know whether it's a big issue in Mexico or not. In Israel, I wouldn't say that it's a major issue, but there are certain parts of the population where it is an issue. People who are into conspiracy theories, they try to spread messages that the vaccine is a conspiracy to do all kinds of things. Now, the government has really tried to identify who spreads these messages and shut them down on social media, on Facebook, on Instagram, on Twitter, etc., etc. And finally, I think there is something that is quite unique in Israeli culture, which is people don't like to be left behind. People don't like to be freierim, suckers. So if they see other people being vaccinated, they think they're missing out, so they also want to be vaccinated, which I think, is not the most attractive cultural traits of Israel, but for vaccine, it's a great thing because there is a mass effect, and the more people get vaccinated, the more people want to be vaccinated. And it's really interesting that, you have people who actually try to hang out in front of health clinics asking if there are doses available for them. Whereas in the US, for example, there are some clinics that are sitting with no patients because no one is coming. So it's a very, very different situation. Having said that, Israel's been very successful, but it's not been successful everywhere. And already it's the beginning of the vaccination campaign, and we're already seeing inequalities appearing. What we're seeing is that the cities that are wealthy are doing very well. The cities that are poorer, mainly Arab cities, some ultra-Orthodox cities, are not doing so well. And sometimes when you look at one number, at the national level, it hides and it covers these inequalities. And it's important for the government to think about these now, because in order to protect the whole country, you will need to vaccinate everyone. You will need to go to Tel Aviv, and you will need to go to, Caesarea and all these places, but you will also need to go into the Bedouin villages, into the Haredi cities, and make sure that they are vaccinated. Otherwise, the pandemic will continue. And we need to think about different strategies, different messages to ensure that everyone, the message that you need to be vaccinated reaches everyone. Israel and Mexico are very different. Israel is a tiny population. Mexico is much bigger with a much bigger population. It's also not as rich in per capita. But there are huge, like in Israel, there are big inequalities. Some people are wealthy, some people are very poor. So I've tried to think about what Mexico can learn from Israel. You don't have Bibi to deal with, to negotiate with Pfizer to get doses, so that's not something I can advise. But I think that the good things to think about are, I think the flexibility, allowing people to, if there is vaccine available, make sure that people get it. Don't waste vaccines. Don't put doses in the bin, because this is a tragedy. And, you know, seeing that happening in the US, in the UK is very, very hard to understand. I think understanding that if you want true protection, everyone needs to be protected. You know, Jewish, not Jewish, rich, poor. You need to achieve herd immunity. You need to reach not just a certain proportion in the population of Mexico, but everyone, every sector of the population needs to be vaccinated. And I think the last thing is don't, you know, sometimes it can be very confusing. You know, you hear different things about vaccines because you read things on social media. Your friends will forward you emails. Go to trusted sources. Go to, you know, people who are working in this field, who know what they're talking about. Don't listen to every single post that you see on Facebook or Twitter or social media. So I'm going to leave it there, and I just want to conclude by saying that vaccine is really going to be a game changer, and I really believe that it will bring an end to this pandemic. Not today, but in the next few months. And thankfully, there are several vaccines that are available and more coming on the way, but it will take time to vaccinate everyone. So we need to choose wisely who to vaccinate first and ensure that everyone has a chance to get vaccinated in the future. And vaccine will be in addition to and not instead of existing measures to begin with. So this is a very brief summary. I just want to tell you in 1 minute what my team is planning to do in terms of COVID-19 vaccine. These are projects that we are currently trying to get off the ground. We're trying to get the funding and get the staff to launch them. One of them is working. So I'm an epidemiologist, which means that I'm interested in understanding why diseases spread, and I'm working with geneticists to try and find a way to predict who will get severe disease and who will be fine. And this is a very important tool for emergency services, for the army, to be able to plan for these kind of infectious disease disasters. Another thing that I'm passionate about is inequalities and understanding who will be able to receive the vaccine, who is going to be left behind, who is going to be vaccinated, who is responding to the vaccine and who is not, and what we can do about it. That is the second element. The third one is understanding how COVID-19, how the pandemic has indirectly affected health, because the pandemic has disrupted healthcare services. It led to hospitals being closed down. It led to health clinics being closed down. And a lot of people who needed care, not COVID-19 care, cancer care, diabetes care, was not able to get it because the services were disrupted. So now that we're seeing the light at the end of the tunnel with the vaccine, I'm working on understanding who are the people who didn't receive the care that they needed and what we can do to make sure that they get it. I'm also working on a project to ensure that people get the right information about the vaccine and design campaigns to make sure that people can make the right choices and choose to be vaccinated and don't buy into conspiracy theories and other anti-vaccination messages. And finally, I'm trying to start a cohort, a group of people who were infected with COVID and follow them over the next few years and understand how the infection is going to affect them. And what we're doing is we're comparing different group, Jews, Arabs, men, women, different age groups, to see again who is going to most suffer, who is being most affected, and how we're going to try and mitigate the long-term effects. So I'll leave it here, and I think I can see more than 50 questions already, and we have about 10 minutes. So I think, Dr. Kably, will you choose a few questions for me to answer?
Yes.
Well, first of all, yes, thank you very much, Professor Edelstein. It has been super interesting, very, very important information. Yes, we have a lot of questions. We will give 10 more minutes because it's a very special occasion and people wants to know a lot of personal or general issues. So, gracias a todos por su presencia, por sus preguntas. En lugar de terminar a la 1, esta vez por ocasión especial vamos a terminar una 10 y vamos a intentar responder la mayor cantidad de preguntas. El doctor Kably durante la conferencia ha hecho una magnífica labor abreviando un poco las preguntas y las similares las hará juntas. Y por favor, doctor Kably, adelante.
Gracias, Nelly. Thank you, doctor. We're going to start, vamos a empezar con la sesión. We're going to start with the session of answers from doctor. And I have here a summary. Yo tengo aquí un resumen de cuáles fueron las preguntas más frecuentes. I'm going to ask to Dr. Edelstein in English. If you, I'm talking to the people, don't understand, we are available to traduce to you, okay? The first one that is very repeat is there, doctor, a particular vaccine brand to choose or discard? What do I must evaluate to choose the best? And many people are asking about the Sputnik, the Russian vaccine.
Okay, that is not an easy question for me to answer because, well, there's several things. First of all, each of the vaccine goes through a process of efficacy and safety. So any vaccine that comes on the market will be effective and will be safe. Otherwise, they will not have the authorization to be released. As far as I know, the 3 vaccines that I'm most familiar with are the Pfizer vaccine, Moderna vaccine, and the AstraZeneca vaccine. They are all more or less equivalent. The AstraZeneca vaccine has a little bit less efficacy, but it also, it doesn't need to be into a deep freezer at -70 degrees. So that is a great advantage. My advice to you, especially now that the number of doses are limited, there are no bad vaccines on the market. If you get offered a vaccine, take it. There is no one that is completely standing out, and there's no one that presents a risk compared with the others. In terms of the Russian vaccine, it's a little bit more difficult for me to say because the data is not available in the same way than the other vaccines. But from what's been released, it seems to be at least equivalent to the other vaccines, but I couldn't swear because I haven't seen the data myself.
Perfect. Another question is the risk and side effects of the vaccine, and who is not candidate to receive the vaccine? Who doesn't qualify to get it? There are many questions about patients with cancer or some chronic disease that they are afraid to be vaccinated.
Mm-hmm. So actually, there are almost no contraindications to the vaccine. The only one is if you had in the past very severe allergy, the type of allergy that gives you an anaphylactic shock, then you should receive the vaccine in a medical environment with some epinephrine close to you. In fact, if you have a chronic disease, you are more vulnerable to COVID, so it should be an extra reason to be vaccinated, because the risk of COVID, if you have certain chronic diseases, is actually higher than in healthy people. It's not a contraindication to be vaccinated. The only group that is not being vaccinated at the moment is children, not because it's not safe in children, but mainly because the clinical trials did not include children. And also there are less at risk, but this may change in the future. So no specific contraindication apart from severe allergy, which is not a complete contraindication, which just means that you should take certain precautions if you receive the vaccine.
And what about the pregnancy and breastfeeding people?
So yeah, pregnancy and breastfeeding is a little bit controversial in the sense that normally what happens is the pregnant women are not included in vaccine trials or clinical trials in general. But often what happens is, some people are pregnant and they don't know about it. So they start the trial and they only realize that that they're pregnant sometime after they've received the vaccine. So there are pregnant women in the trials who received the vaccine, and from this data, it doesn't seem to be dangerous for either the pregnant woman or the baby. But this may depend on each country, and I don't know whether in Mexico they will license for pregnant women. So what I would suggest is, if you're pregnant at the time of when you become eligible, to check with your doctor whether you should receive the vaccine, because this, I don't want to advise something that will be against the recommendations of your own government.
Okay. And another question is, is it possible, if I get the second dose vaccine, have COVID again in next months?
Possible. So it's possible, but it's very unlikely. So once you have 2 doses of the vaccine, your risk of infection is 95% lower than if you didn't receive the vaccine. It doesn't mean that your risk is 0. It just means that it's much less likely, but it's not completely impossible.
Okay. And if I already had COVID, I should be vaccinated, is another question.
So that's a very good question. What we do know is that we don't really know yet whether if you had COVID and you get vaccinated, we know that it's not dangerous. We don't know if it gives you extra protection versus just having been sick. There's a study that just came out in England that shows that if you are if you had COVID, you are about 83% protected against having COVID again, and the vaccine suggests that it can be protective up to 95%. So this suggests that they could be, I'm saying they could be because it hasn't been fully tested, a benefit to being vaccinated even if you had the disease. So again, at the moment, they will not, and not everyone knows whether they had COVID. I mean, some people do because they were sick, but up to 50% of people may have had no symptoms, so they may not know. So again, my advice would be, if you are eligible and if the recommendation is that you receive the vaccine, regardless of your status, you should take it, because it's not going to hurt you and it could help you.
Okay. Another popular question: should I wear mask if I have already been vaccinated? Am I still transmitting the virus if I have been vaccinated?
It's again a very good question. It's not entirely clear. The vaccine trials, what they tested is if the vaccine prevents you from becoming sick. Becoming sick and becoming infected is 2 different things. So it's possible, we don't know yet, it's possible that even if you're vaccinated, even though you're protected against being sick, you could still be infected if you're encountering someone who is infected. And in theory, at least, it means that you could still infect other people. This is an area that is very intensively being researched right now. And again, the Israeli data that came out 3 days ago, very, very fresh, shows that it seems to decreases the risk of infection by at least 50% after 1 dose. So it sounds like the vaccine will also protect against infection and therefore against infecting others. But at least until it becomes clearer, you should continue with the same measures of social distancing and wearing a mask.
Perfect. That is very important for us, muy importante para nosotros porque todavía nos queda un largo camino en México para estar vacunados. Hay que seguir con las medidas generales. And another question is there already information about how often will people repeat vaccination? They say maybe every year.
So no one knows. This discussion is based on the fact that when someone gets infected, what we see is the protection, or at least the antibodies that you have in your body, which is one indication of protection against infection, decreases over time, which means that again, in theory, you could lose the protection that you have from natural infection. We don't know yet whether it means you will also lose protection from the vaccine. It could be that the protection will only last for a year. It could be several years. We just don't know yet. But I think there's a good possibility that the protection will not last for life. You know, some vaccines you receive once, like measles, hepatitis A, and you never have to have again. Some vaccines like flu, you need to be vaccinated every year. My personal opinion, I may be wrong because the evidence doesn't exist yet, but is that this vaccine will be somewhere in the middle, maybe every few years. It also depends on, I'm sure you will have seen the discussion around mutants and variants. If some variants, if the vaccine does not protect against some of the mutant strains, then it's more likely that you will need to be vaccinated with an update every year or every few years. But this is, again, they're all excellent question. It's every day there's new information. So I'm telling you what we know as of today.
Okay. And here we have another one. With all the respect to people, do you suggest, you already have answered that, any brand specifically? In Israel, you are using just Pfizer?
In Israel, we are mainly using Pfizer. There's a few doses of Moderna as well, which I understand is used in the army.
Okay.
But I personally, I would receive any of the vaccines, at least any of the vaccines that is licensed, I would happily receive.
Okay. And I think this is the last one. You also have answered that, but the people are asking about this. If you can calculate the percentage of a population in any country that must be vaccinated to achieve herd immunity.
Again, it's not really known, but considering how the virus spreads, and this is assuming that you know, there are no mutants strains that escape the protection given by the vaccine or by natural immunity. When you get to 50%, you will start seeing the rate of infection decrease pretty rapidly. When you get to 70%, you will see very low levels of infection. And when you get to 90%, you're basically okay. But there's a big but to this. When you say 70%, it's very different if you have, 70% could be 100% in Mexico City and 20% in the rest of the country. That is not the same as 70% everywhere. If you really want to see a protection at the national level, you need to reach every part of the population with the same level of coverage.
Perfect. Okay, Dr. Edelstein, it's an honor for me to be here with you, and I give the microphone to Nelly, that she have some words for you and all the people. Nelly, please.
Well, first
No
of
le
all,
preguntan si cuando uno ya tuvo COVID, cuánto tiempo de inmunidad presenta.
It has been an honor, really. Thank you very much, Professor Edelstein. Doctor Kably, gracias infinitas por su participación, por su ayuda. Quiero agradecer profundamente a todas las instituciones y los medios que nos apoyan siempre, a las comunidades, a la embajada, y invitarlos a la siguiente conferencia, que sin duda será muy interesante. Tenemos este tipo de conferencias cada mes. Los invitamos a que no se las pierdan. Síganos en redes sociales para que estén al tanto de las conferencias que iremos teniendo. Y los dejo con un video. Muchísimas gracias.
¿No lo van a traducir?
Lo vamos a intentar, lo vamos a traducir y ponerlo en la página de los amigos mexicanos.
Sí, la conferencia se queda grabada, incluso para las personas que no tuvieron oportunidad de entrar porque la sala se llenó antes de la hora. Les agradecemos también por eso. Gracias, Nati. Cerramos con el video, por favor.
¿Puedo decir algo? Mi pregunta no la contestaron. ¿Puede tomarse alcohol después de haber tomado la primera vacuna? ¿Oíste?
Profesor Edelstein, are you there?
Yes, sorry. ¿Puedes repetir la pregunta?
If you can drink
Que si se puede tomar
even the first doses.
If you receive the first dose, sorry?
If you can drink alcohol.
Ah.
That's the question.
Yes, there's no, I don't think there's any problem with drinking alcohol. Obviously, you should drink alcohol in moderation. But yeah, you can drink alcohol at the same time. That's fine.
Let's say tequila.
Oye, doctor, tengo una pregunta. Yo tengo COVID ahora y me vacuné hace 9 días. ¿Le puedes preguntar qué es lo que está pasando? ¿O qué tengo muy leves síntomas, pero tengo COVID ya confirmado desde antier?
Si tengo COVID ahora, quizás sería mejor de esperar un poquito hasta el tiempo que se siente bien y pregunta. Normalmente debe ser, normally you should wait until you feel 100% okay in yourself. First of all, refuah shelema, and yes, you should wait.
He's already gotten the vaccine.
You already received the vaccine.
Yes, 9 days later he got COVID.
Okay, so the problem is when you receive the vaccine, the protection doesn't start straight away. It takes about 2 weeks to get the protection. So now you got the vaccine, then you became sick. Is that right?
Yes, I am sick now. Very small.
Very small. Okay. And then you're going to receive the second dose in 9 days. Is that right?
In 9 days exactly. The 26th.
Okay. I think if you're feeling well, then you should complete the course. If you're not feeling well, then you should delay until you feel you don't have. If you don't have a fever, then you should be okay to receive the second dose.
Tengo
¿Y la
entendido
vacuna también es efectiva contra las nuevas?
Perdón, Dora, un momentito. Lamentablemente el tiempo se nos terminó. Me comprometo a hacerle llegar las preguntas al profesor Edelstein, que se las pueda responder si a él le parecen bien. En este momento tenemos que terminar la transmisión. Nuevamente agradeciéndoles muchísimo el que hayan estado con nosotros.
Pero,
bienvenidos sean todos ustedes y nos vemos la siguiente vez.
Fue toda en inglés y no nos tradujeron nada.
Yo quiero preguntar si la vacuna aparte. Pregunta bien.
The future is now.